So dear students, today we will discuss I will show a instrument which is a recent one of course, which is now started using day-to-day surgical practice in OT. So just find out what this instrument is. Look at that, like a razor it is, which got a blade there, which has got a holder here, which has got a controller here, and different blades are there. So it's a very typical of electrical dermatome. Now these electrical dermatomes are used to take the skin grafting for split skin grafting or pierced graft, otherwise called as. There was split skin grafting or the full thickness grafting. Split thickness graft is only part epidermis and part of the dermis is taken. Again here there thin, medium, thick is there, 3 levels. Entire skin is taken, both epidermis and dermis. That is wolf graft, otherwise called as. So split thickness graft, full thickness graft. Split thickness pierced graft, MCQ question, remember. Wolf graft is full thickness graft. So this is to take split thickness graft. Means a graft from the dermis, not from the epidermis. The dermal grafts are totally different. There's a cultured one. Because epidermis is avascular, dermis is highly vascular. That point you have to remember. So other olden days, of course, even now most of the hospitals what you use is Humvee's knife. It's a manual one. Your right hand knife or Humvee's knife, left hand Humvee's knife is there. You use a Downs blade or Ashman blade, slot it, adjust it, and take the graft. It's a manual one. With the pressure you take it. Where here it is very easy to take. It won't injure the subcutaneous plane. It is very uniform. Good length you will be able to take. That is the advantage of this electrical dermal, but it's costly. Availability is a problem. So, but eventually this is the ideal thing. The large graft, wider graft, easier graft with less problems in the donor area because uniformity is there. That is the advantage of electrical dermal. Of course, Humvee's knife will be kept as a oxy or instrument tray. Why what they will ask, or when you present the ulcer case in the exam, what knife is used, or you should be able to tell Humvee's knife. You should be able to identify Humvee's knife in the instrumented way. Blades are Eschman blade and Downs blade, and donor area is commonly thigh. Occasionally, a large area required, you can take arm, forearm, other areas. Otherwise, thigh circumferentially, whatever you are taken is the common site. Remember, is the thigh. Remember, and there are stages of graft intake for the split thickness graft. Stage of plasmatic imbibition, the stage of neovascularization, stage of circulation. You can always go through my SRB's manual of surgery for detailed discussion about the graft and reconstruction ladder that is there in the reconstruction topic in SRB's manual of surgery. You can go through that. So, because very common short note aspect is the split thickness graft, otherwise called pierced graft. Very common short note aspect is also full thickness graft and otherwise wolf graft. So, you should know the indication, donor area, technique of placing it, knives used, blades used, and stages of graft intake, and complications of the graft, and where all you will use, what are the criteria to use. So everything is there in my book. Please go through that as for further readings. I already told stages of graft intake, so that you can go through my book for detail and remember problems and complications. Contracture of the graft, infection, graft failure, seroma formation, hematoma formation. So all these things are the complications of the graft. Again, you can go through my SRB's manual of surgery chapter reconstruction for detailed explanation with the photos and with the illustrations. Student, please subscribe my channel website for all different topics, so that we'll have the ulcer examination also there. Different ulcers, final treatment is skin grafting. It's always correlate to this topic also. Also go through my SRB's manual of surgery for skin grafting and ulcer topics in detail, so that you'll have the idea. I request everybody to subscribe, and also request your friends to subscribe my channel for daily lectures and daily MCQs and daily quotations. So answer the MCQ, students. I will put it in the comment box. I will go through that and I will acknowledge your answers and give the explanation for that. So wolf graft is split thickness graft, full thickness graft, composite graft, complex graft. Find out. And deltopetal flap is cutaneous flap, myocutaneous flap, osteomyocutaneous flap, free flap. So go through my reconstruction chapter in SRB surgery. It will give the answer. Also give the answer for different flaps, graft, differences between flap and graft, king graft, and in detail explanations. So this MCQ answer also will be there again, and I'm requesting to subscribe my channel so that you will have the wider area of different lectures for your surgical understanding. So students, I hope next, sorry. Students, now the important thing is look for the quotation of the day. Don't give up. Beginning is always the hardest because to start a work is difficult. Once you understand the modality of mood of that, then you can always go through that. To learn a skill, initially it's very, very difficult. You have to really put hard work on that, put everything on that. Once you get that, then you are through with that. That is exact meaning of that. Don't give up. Beginning is always hardest. It is not easy path to start anything. You have to think, you have to redo it. Then you will have a proper pathway. That's the exact meaning of this quotation. So students, please go through my SR-based clinical methods in surgery, current edition, which gives in detail about the clinical exams, all chapters, including X-rays, other images, basic instruments, specimens, and gives a very lot of photographs are there, figures, illustrations are there for your benefit. Detailed clinical methods and case sheet rating is there. That's very important for clinical surgery. And manual of surgery current edition gives the detailed discussion of all topics, specialties, urology, cardiothoracic, and other chapters, including instruments, operative surgery specimens, as per CBMA syllabus in detail for your knowledge, exam, theory, clinicals, everything. Please go through that. And of course, my operative surgery book with the 2 volumes, very useful to understand the very operative procedures with the step-by-step technique. And my atlas of tissue approximation, small book with a video. All this contains a video, like a video of the demonstrations of different things. It also gives a suturing technique very briefly, very nicely, and with the principles. Please kindly go through that. And my SRB surgery insights and YouTube different channels, my website. You can please subscribe. That will give a lot of information and it will be very, very benefit for all students. And please subscribe my SRB surgery insights of different modalities for understanding better knowledges and subjects, because best topic, different versions are there in small topics in the website, and this is the QR code for the same. So students, I hope you have understood this lecture, MCQs and quotation very well. Thank you so much. Again requesting, please go through my website, subscribe my website, go through my books. Thank you very much.